Everybody, Clark County is finding more beds for the sick, and they will need them. Clark County officials updated the fight against the virus today. But first, the backdrop. The latest numbers from the Southern Nevada Health District, current as of yesterday, show there are now 2,009 positive cases here in the valley, including 71 deaths. In Las Vegas, right now it's all about hospital capacity. Peak hospital use is now projected to hit our area sometime around April 17th. That's according to the Institute for Health Metrics and Evaluation. Its numbers are followed closely.
Just know Nevada hospitals and our local hospitals in the valley are working tirelessly to prepare for a surge here in Las Vegas.
That's UMC CEO Mason Van Houweling saying he expects the week of April 19th to be crowded with COVID-19 patients.
We anticipate an increase and we're seeing an increase in COVID-related symptoms.
Local hospitals still have a little breathing room. According to Van Houweling, in Clark County right now, we're using 79% of our 609 ICU beds. We're using 51% of our 681 ventilators. And we're using 65% of our total number of regular hospital beds, which stands at 4,542. At his hospital, UMC, more than half of his 133 ventilators are being used by COVID-19 patients. But that's before a wave hits, and that's why Clark County is finding other beds to boost capacity. It wants to add 500 beds. Today it said it found some. Commissioner Marilyn Kirkpatrick.
We have 150 of those 500 beds solidified, and we will continue to work every day. We're already making calls.
All this comes as the county remains on a virtual lockdown, and thank goodness for social distancing, says Van Houweling.
My anecdotal and just what we've seen is the volumes could have been a lot worse if we didn't implement a lot of things that we've done.
And speaking of social distancing, that health metrics group I just told you about initially projected that Clark County would see more than 900 COVID-19 deaths through the summer. It has now cut that to 445 if we follow what it calls full social distancing through May. In Las Vegas, Jeff Gillen, News 3, back to you.
Virus does not discriminate, and whether you're a celebrity, a medical professional, or on the front lines battling this disease, we want to let you know that you have the hearts and the feelings and the prayers of so many people, celebrities included. Joining us now with a look at how a local restaurant is packing lunches to serve is News 3's Kyle Wilcox. Kyle?
El Dorado Cantina here in Tivoli Village put together 100 lunches like these to give out to medical personnel. They received help assembling from two familiar faces, comedian Eddie Griffin and former NBA and UNLV player Marcus Banks. El Dorado Cantina is loading lunches and giving them to local hospitals.
We want to supply them with a good, healthy meal from El Dorado and just help out.
Entertainer Eddie Griffin was there to lend a hand along with former NBA player Marcus Banks.
Oh, yeah.
The two pandemic volunteers loaded up tacos bound for Mountain View Hospital.
It's definitely something that's mandatory. It's something that's needed. I'm sure the people out there will appreciate it. You know, it's much more in the world that's going on now instead of, just sports. And right now the city needs us.
If this meal can put a little glow in their life, a little light in their life, then I'm all for it.
The Tivoli Village restaurant recently launched a program called Feeding the Frontline to serve local medical professionals. Banks and Griffin were happy to help.
Community work, and I very, very much enjoy it.
The coronavirus has affected Las Vegas as it has the world, and Griffin joked about missing one of the city's signatures, the lights.
I thought I'd never see the lights go out in Vegas. The lights are out, man. Y'all need to pay the light bill. Just at least light it up so we can get a semblance of Vegas.
However, he believes Vegas Strong will beat this crisis.
I think Vegas is going to come back really big, really strong.
We're going to stay together. We're going to keep the community strong, and we're going to hold it down.
It's supposed to be the 2020 home opener for the Aviators at that beautiful Las Vegas ballpark. But as we know, the coronavirus has put it all on hold. Amber Dixon caught up with the Aviators president, Don Logan, who's also the chairman of the Pacific Coast League's executive committee, to get his thoughts on this uncharted territory.
There have been a few reports this week that Major League Baseball could start its season in Arizona. How would that impact you? How would you go about starting your season then?
Well, we just talked about that on all 5 calls I was on today, and I think that was something that was thrown out there. It really is speculation. We're calling it fake news. It's something that when they're talking about getting baseball up and running again, they want to have additional spring training. They need to get the players back in spring training, get them ready to go. The possibility exists that they may do that with no fans in the stadiums, but nothing's been decided really.
But they're talking about the actual season continuing past spring training.
Yeah, you just think about that. Everybody says, well, there's television revenue for Major League Baseball. There is, but on balance, it fluctuates. The Yankees and Dodgers, some of the bigger market teams, have significantly more TV revenue than some of the other teams that most teams really rely, like we do. They rely on ticket sales, they rely on concession sales, they rely on merchandise sales. It's not going to make economic sense for them to not have that.
Across the Las Vegas Valley, local grocery stores are now filled with shoppers who are following the CDC's recommendation to wear masks. That recommendation that anybody who goes outside their home should wear a mask to prevent the spread of COVID-19. Our Lauren Clark talked with some local doctors on what they recommend that you do to get the best protection.
Well, the CDC says you can make a makeshift mask from a variety of household objects, including a scarf, dish towel, even an old t-shirt.
From videos on YouTube,
bandana headbands,
to pictures online, to the U.S. Surgeon General creating his own DIY mask tutorial.
Out of an old t-shirt.
Masks are everywhere and can be made from nearly everything. Bandanas, scarves.
bra has the elasticity.
Yes, even bras.
And double the cup to allow more of a barrier.
Dr. Dahlia Walks is a local board-certified family physician. She says there's plenty of ways to make face masks fashioned at home, a new federal recommendation for anyone in public. But the CDC hasn't always had this stance. Original guidance stated these DIY masks were unnecessary and unhelpful to protect against the virus. But new data from other countries is changing minds, says Dr. Christina Madison.
They have seen some significant decline in number of cases when they saw the general public wearing masks on a regular basis.
That's because many people who have COVID-19 are asymptomatic, she says, and could unknowingly pass it on to others.
Really, we just want you to be able to keep your respiratory droplets to yourself.
But even Batman or Superman themed masks won't give you powers against the virus.
Don't feel like you're a superhero. Just because you have a mask doesn't mean you can't get it into your eyes or other sorts of orifices.
It's why you should still remain at least 6 feet away from others and always wash your hands.
This is another extra added layer of protection.
Well, medical professionals say this is the correct way to take off a face mask using only the elastic and not touching the front part of the mask. Then you're told to put it in direct sunlight to kill any viruses. Make sure you wash your hands and wash the mask in between each use. Now, as a reminder, those N95 masks really need to go to our medical professionals who need them right now. The rest of us here in public can do with these DIY masks.